Tonight on WCNC Charlotte, cold and flu season off to an early start. Thank you for staying with us here at 5:30. I'm Fred Shropshire.
And I'm Vanessa Rufus. Across the country and here in the Carolinas, hospitals and doctors' offices are starting to see a rise in sick people. And so far, these viruses seem to be hitting kids pretty hard. In fact, the CDC says 1/3 of flu hospitalizations are kids. And we've told you this, Aquadale Elementary and South Stanley Middle School in Stanley County announcing today students will not return for in-person class until next Tuesday because of a spike in respiratory illnesses.
WCNC Charlotte's Chloe Leshner explains what's happening here in the Carolinas and what parents need to know.
Both North and South Carolina already have high flu activity. Doctors say there are several respiratory viruses going around right now, and RSV can be especially dangerous for babies. Newborn Liam is back home with his parents and older sister after spending more than a week in the hospital with a severe case of RSV.
They end up having to intubate him, get him on a ventilator, and move him down to the intensive care unit that night.
Liam, one of dozens of babies and children hospitalized in South Carolina with a respiratory virus. Doctors say RSV and flu are the most prevalent, reaching peak levels much earlier than normal.
What's unusual about this year is the number of patients that we have who are critically ill, all in a very short period of time.
Dr. Allison Eckert, a pediatric infectious disease specialist at the Medical University of South Carolina, says fewer COVID precautions and lower immunity after several mild flu seasons is all adding up.
And all those things have created a perfect storm of this surge that we're seeing.
Someone can get RSV more than once in a short time period, and doctors warn there could be a second peak in the winter. In the Charlotte area, pediatricians' offices are seeing more patients, and hospitals are preparing for beds to fill. Doctors urging parents to know the signs of when RSV is escalating.
If we're working harder to breathe, if you see a child who is getting tired with their breathing, using extra muscles in their neck and chest to take a deep breath, that would be a reason I would want them to seek medical care immediately.
Doctors say the best thing to do right now is to get the flu shot. They say parents should get their kids and themselves vaccinated before the end of October. In Charlotte, Chloe Leshner, WCNC Charlotte.